Assalamu alaikum warahmatullahi wabarakatuh. This is Dr. Ivan Bastawisi. Today we are diving into a key cool case for MRCOG Part 3 exam. Just to keep things simple, we are using the Warrior MRCOG Part 3 materials. As usual, my dear warriors, let's not waste your time. Today's topic is sexual assault, and our station is a teaching station. And if you ask me, studying any topic as if you are dealing with teaching patient would make you very well prepared to pass any simulated patient task or structured discussion question regarding this topic. And why? Because if you are going to be able to um, explain to your colleague the idea about the topic in an organized way, then your mind also is going to be organized so that when you deal with the topic in other way, you will be able to be very clear, organized, and confident. So let's do it together and start breaking this topic, this important topic, which is a must in every and each exam. Now, this is simulated training task mark. Mark will be awarded for the patient safety, information gathering, communication with colleague, communication with the patient, and applied clinical knowledge. And you are the ST5 specialist registrar who will meet with the FY1 in the emergency department, your colleague Fabri Joule, who had a patient of sexual assault yesterday and wants to know about the topic. Now, you do have 10 minutes in which you must teach your junior about the sexual assault management and answer her questions. Now, this was a diagram that Fabri made to document and describe the finding she had. All right, now let's start to discuss the model answer. Start with the template for any teaching station. So your introduction should be friendly and should cover some important points. So when you introduce yourself, you are going to say hi or hello, I'm Iman. So you would not say I'm Dr. Iman because this is your colleague, not a patient. So I'm Iman, the ST5. How are you, Fabri? And remember, for the teaching station, please write down your colleague name in the paper that you are going to be provided with in the exam, so that only one glimpse to your paper, you're going to find the name of your colleague. So when you need it, you need to clearly say the name of your colleague. Okay? So, how is everything in the department? Do you feel supported and encouraged? Be sure first, before discussing any topic, that your colleague is comfortable and is well supported. Because sometimes the station that appear to be teaching actually actually turn to be a station of bullying, and it's not about the topic actually. So the next step is to confirm the topic to be sure that what you have understood from the case note is correct. And this also, my dear friends, goes for with the submitted patient task. You need to clarify the task or the main reason of your station. So I understand you want us to discuss sexual assault. Is that right? Then, if it is correct, then your colleague is going to tell you yes. Now, next step is to rule out bullying by asking about the reason behind the question. Then you should show understanding, support, acknowledge the importance of the topic your colleagues ask about, and check the background. So, how to do this? You can say, this is an important topic to discuss. Did you read about it? Usually the answer is going to be no. So, you need to be gentle, again, friendly. You can say, no worries, we will cover it together today. Now, remember, my dear warriors, to keep smiling and keep eye contact with your colleague. This is very important for the communication, either with the colleague or in case of the question is submitted patient task, and even in the structured discussion. Keep smiling and keep eye contact. Now, for the agenda of your meeting, you need to just give us a quick hint about or your opinion about the topic, and then you promise your colleague to provide him or her with materials and request feedback. Now, how can you do this? By saying addressing a patient who has experienced this event requires careful consideration. We will discuss three aspects of this topic today: the legal, psychological, and the medical aspect. And by the end of our discussion, I will be sure to share relevant links and articles with you. I'd also appreciate your feedback on our conversation afterward. Does that sound good to you? I would encourage you, my dear warrior, to do or to adopt this strategy. Promising your colleague to give a relevant article and to ask for feedback in the very beginning in the agenda setting, so that if at all you were not able to complete your station in the exam, so at least the mark regarding the communication with the colleague is going to be full for you. All right? Okay, so let's start, and please stop me if you feel that you need any clarification or have any questions. Okay? Now let's start with the legal aspect, starting with some definitions. Now, what is the sexual assault? It is when a person intentionally touched another person. The touch is sexual and the person does not consent. Now, the serious sexual assault is when a person commits assault by penetration, that is, intentionally penetrated the vagina or anus or of another person with a part of the body or anything else without the person's consent. However, rape is where the penetration is of the vagina or mouth and with the penis, and again without consent. Okay, now you gave your colleagues some definitions, all right, and it's a bit some rough information, so it's better to check if he or she comfortable. So, is that clear, Fabri? And then yes, it is. Right now, I need you to know that the age of consent to any form of sexual activity is 16 years for both men and women. And it is an offense of anyone to have any sexual activity with a person under the age of 16. All right? So, just an advice, dear warriors, I need you to know that whatever written in bold in our materials is a must to speak. However, whatever it is not bold and it's of small size font, so you may skip it because just to make the script clear for you, I wrote those notes. However, in the exam, what's written in bold is the important information that you need to speak with your colleague or in your exam. Okay. Now, the next point we need to know is that the most sexual assault go unreported, so nearly 9 out of 10 survivors never make a formal report. Despite the reporting to the police is essential, however, we need to respect the patient decision not to notify the police unless serious cases where harm may occur to others, for instance, in situations with domestic violence where children or other individuals could be at risk. Am I making myself clear, Fabri? And see here, my dear warriors, because this is an important part related to patient safety, you need to check the understanding of your colleagues. All right? So, am I clear? Am I making myself clear, Fabri? All right, yes. So, could you recall what the age of consent to any sexual activity is? And my advice usually when you ask your colleague a question, because typically they are not doctors, so make it a simple one. So you need to ask a question in the teaching station, of course. So make it simple, make it short, and so that the role player will not waste your time. So because, like, for example, this question, the answer is 16. That's it. 1 second. So you are keeping your precious time saved. You got the mark that is related to asking your colleague a question, okay? And it's simple. So he or she would not be confused. The answer is clear. And when he or she answered correctly, you should encourage and acknowledge that your colleague is perfect, and you can tell him or her you're a fast learner, right? Like a compliment. Very well. Now, the last legal aspect we need to remember is that the medical notes may form a part of the evidence. So we need to write down exactly what the woman says in her own words. And remember that discrepancy in the story could be used in court against her. Right? Is everything clear so far? Now you completed your legal aspect, so confirm that your colleague is following you. All right, now coming to the psychological aspect, women often questioned whether they were to blame for the instance, so we must tell her clearly that it's not her fault. Um, Also, this patient should be connected quickly and directly to the right healthcare professional. In other words, her case should be a priority. So we should not leave this patient in the triage area for a long period. We need to be sensitive and non-judgmental during consultation, and we need to listen to the patient and believe her account. Now, one important point that we need to ask her clearly if she feels safe going home. And if needed, sometimes we may admit her till the safeguard team will arrange for safe environment for her. Make sure that the patient will be provided by patient information leaflet and connect her to the SARC team. SARC team are very crucial in taking care or managing patient who is a victim for sexual assault. Are you following me so far? All right, very well. So let's discuss the medical aspect then. Now, while thinking medically, still we should maintain respect, confidentiality, empathy, and build a rapport with the patient. First, we settle pain and exclude any serious injury like severe bleeding. Now, if the patient is pain-free and she is not at risk, we start information gathering. The 4 questions are how, when, where, and who. So the time of the instance, the nature of the event, possibly use of any drug or any toxins, alcohol. Ask the patient if she remember what happened and the person, if at all she knows any of them. Advise the patient not to wash or wipe herself if she is considering a forensic medical examination, and advise her not to eat, drink, or pass urine till the collection of the early evidence. And let me tell you a note, dear warrior, here. Yes, we can advise the patient not to wash or wipe herself for a while till the forensic team are here. However, for drinking, eating, and passing urine, it's not possible to ask her just to hold herself till the forensic team is here. So what we as a gynecology do usually is we collect the early evidence kit, and it is available in the emergency department in each trust. So we can collect the minimum sample, so we can collect urine, the mouth rinsing, okay? Then the patient will be able to eat or drink. Okay, so I mean, as a human being, we cannot just ask her to stop eating and drinking for hours. I mean, she's a victim by the end of the day, right? All right, so now let's continue our station. Then we proceed with the sexual history, contraception history, and this is important if the patient is on regular contraception or not. Otherwise, we will think about the emergency contraception. Menstrual history is crucial. Also, we need to know which day of her cycle she's in, and to decide again about the emergency contraception. Um, Remember to ask about allergy, body mass index, medical history, surgical history, social history are all are important. Clearly, we need to ask the patient about her wishes to involve the police, and we can ask her if she had already met the SARC team or not, because this will save you a lot of time. Actually, like the SARC team, usually they start the emergency contraception, they start the psychological support, the sexually shared infection. So basically, they do everything. So ask about the SARC team if she already saw them or not. Um, Next coming is the examination, and of course, as we all know, our dear warriors, so the examination is in presence of a chaperone. Okay, it should be gentle, empathetic, and typically many women complaining of sexual assault will have few or no injuries, and likely the injury would be on the body rather than the genitalia. So any injury should be treated with basic first aid. However, um, again, very important patient safety. Minor injuries that do not require suturing should not be cleaned initially because samples can be taken from these sites for DNA evidence. So you need to speak this to your colleague, dear warriors. Now, injuries that are identified should be recorded accurately in the record, in the medical records, and each injury should be described in detail, like the shape, depth, color, tenderness, relation to anatomical structure, and the typical name of the injury, like bruises, abrasion, laceration. Regarding the photography, it's typically the job of the police, the SARC team, or the forensic medicine team, because typically it needs written consent. So for the gynecologist, this is not our job. However, the diagram is yes, we can do this in a proper way. Collecting sample during examination is simply something logic. So we take swabs for sexually shared infection. And also we can collect some urine sample, mouth rinsing, and some tampons, sanitary towels, or what have you. Documentation is very important with the patient name, date of birth, NHS number, the full name of the healthcare professional, the ID number, and the date of and time. Now, we need to think about emergency contraception. If the patient is not using regular contraception, we should clearly inform the patient that the intrauterine contraceptive device is the most effective method of emergency contraception. However, still we can discuss with her the oral emergency contraception. The sexually transmitted disease is a very important point to think about. So, typically, for during the examination, we need to take swabs for gonorrhea and chlamydia, and we take blood sample for the bloodborne viruses. We can discuss with her about the HPV, post-exposure prophylactic after sexual exposure, and this is valid if the assault occurred within the last 72 hours. We can also discuss if the patient is not vaccinated against the hepatitis B virus. So we can offer her the vaccination. The schedule is typically 0, 1, and 3 weeks, and then the last dose is 12 months. We need to refer the patient to the gum clinic after 3 weeks for screening for gonorrhea and chlamydia, and after 4 months for the hepatitis, HIV, and the syphilis. We need to consider if tetanus toxoid is needed. And before discharge, again, we need to be sure that the patient already received the written information, the contact detail for the support service, the clear follow-up plan, and that she feels safe to leave. All right, so this is the management of the patient with the sexual assault. Now coming to the diagram that you provide, which is actually very impressive. I like that you've used a body outline and labeled the site of the injury. Well, if you could just next time to remember that you make sure that you write the date, signed the document, and store it in the medical records. Also, you can uh, briefly add some key for your samples so anyone reading it later understand it straight away. You're doing the right things by drawing entries. Keep using the diagram like this. All right, now coming to the last part in your station, which is again a template for almost every teaching station. So you clarify if your colleague needs you to answer any questions, and then again, now provide your colleague with the materials, ask clearly for the feedback, and thank your colleague for his or her time. Right, so, and now it is the end of this station. And that's it for today. I hope this was helpful for your exam preparation. If you have any questions or tricky topics, drop them in the comments or message me directly. I'm here to help. Thank you for your time.